guest is Sharon Lagas, who's the president of the Alport Syndrome Foundation. Hi, Sharon.
Hi, Kevin. Hi, Chris. Thanks for having me.
No problem.
Sharon, we're just going to talk a little bit about Alport syndrome for listeners who may not know anything about the disease. First off, if you can give a brief explanation of what exactly Alport syndrome is.
Sure. Alport syndrome is a inherited or genetic kidney disease, and it causes progressive deterioration of the kidneys, as well as kidney failure, causes hearing loss, and it can cause vision problems as well. And it's all because of a little collagen defect in the connective tissue that they call basement membranes that are in your kidneys, in your ears, and your eyes.
Okay, next question. How did you find yourself as the president of this organization?
Well, that was quite a journey. So in 2004, I lost my brother at the age of 38 years old to the effects of Alport syndrome. He'd had a transplant for about 20 years, and he passed away. And I found out the same month that he passed away that both of my boys had inherited the disease, and they had actually inherited it from me, and that my brother's two daughters had inherited the disease from him as well. So as you can imagine, and then my mom was the first person to pass it on to all of us. So we were very overwhelmed as a family, and I really only wanted to connect with other people that had Alport syndrome and went through the same thing. And there was nothing really available at that time. There was the National Kidney Foundation and other national, but nothing really for Alport syndrome patients. And so I complained to my brother's nephrologist about not being able to connect with other families, and he said, well, I know other families that have started it. Why don't you start an organization? So I thought about it for a while, and then I was able to connect with several other people, including other Alport families and patients, and we launched the foundation in 2007, just so that nobody ever feels alone again and always has somebody to connect with and talk to when they're diagnosed with the disease.
Okay, that's great, because my next question was going to be, what is your mission? But it seems it's obviously to be networking with other patients and to provide support and resources for them.
Yeah, and as well as, we want to support and provide resources to the patients and empower them so that they can advocate for themselves. But we also want to fund research to make Alport syndrome a treatable disease, because we want to go out of business. We want to cure this and move on to bigger and better things, and not have anybody have to worry about their kidneys failing because of Alport syndrome.
Right. Sounds good. The reason we're talking today, too, is obviously because last week there was something very important going down in Washington that you attended. So, Chris, if you want to lead the conversation, we're going to speak to Sharon about last week's Kidney Patient Summit.
Okay, just like, I guess our question would be, what exactly was the summit?
So, the summit was organized by the National Kidney Foundation, and they brought together 6 different kidney organizations to bring patients to Capitol Hill to advocate for better outcomes, better legislation for kidney patients. And I'd like to say that this is the second year that the National Kidney Foundation has done this, and there were actually 100 patients total that descended on Capitol Hill, and the date was very important because it was for the kickoff for National Kidney Month, the beginning of March.
Mm-hmm.
And anyone else from Alport Syndrome Foundation happen to go?
Yeah, so we had 7 advocates that
Nice.
went. We had a gentleman by the name of Kevin who had given his kidney to his son. We had another gentleman by the name of Bob who had received a kidney from his sister, and she was there as well, and that was 33 years ago. So he's had a transplant for 33 years.
Wow.
And there was another gentleman there Marty, who has 3 sons affected by Alport syndrome. And then we had another family, and it was Susan and her mom Sharon and her daughter Drew. Drew is 11 years old and just went on dialysis, PD, this past year. And she was the youngest advocate that was there, and was there advocating for herself. So I think she's
That's
maybe
great.
the future president of the foundation.
Yeah, I guess a lot of people don't realize that renal disease, not just Alport syndrome, but other kidney diseases as well, there are a large number of pediatric patients, and it's great to see them advocating, especially at that young age. Was this your first year attending the conference, or did you guys go last year as well?
We went last year as well, and that's one of the areas that that ASF and our members are starting to get involved in is advocacy, because we've realized how important it is to join efforts with other organizations. For a small organization like us, it's hard to do advocacy efforts on our own. So joining with the National Kidney Foundation, there's also a rare disease summit on Capitol Hill that we would like in the future. There's also another advocacy day in September with the medical community, the American Society of Nephrology. So it's very important for us to partner with other organizations, and it's also important for us to educate our members. We don't only have to do it in Capitol Hill. So Kevin and Chris, you can be talking to your legislatures, in your state, and making appointments to see them and tell them about the issues that matter to us, and so that's kind of what the area that we're moving into, is really to trying to make our voice heard as there's more more legislation that's coming up that can help us to get better outcomes for Alport syndrome patients and all kidney patients.
Interesting. Real quick, Sharon, from what I understand, like different groups at the summit were advocating possibly for different reasons. Was there anything in particular the Alport Syndrome Foundation was advocating for? I know some groups, for example, just wanted to push insurance or what have you. What was the ASF's goal going into the summit?
Well, I mean, as a group of 6 organizations, we agree on what the talking points are and what we're going to advocate for together.
Okay.
So agreement, and we go through a training, and everybody has the same kind of materials to show the legislators. So there were 5 different points that we were advocating for. But one of the very important points that we really tried to hit home with our legislators is early diagnosis, because there is there is treatment for Alport syndrome to prolong kidney function. It's not a cure. It won't, stop patients from entering end-stage renal disease. But ACE inhibitors, which are very, affordable, they're cheap, they're readily available, can prolong kidney function for quite a long period of time if it's started early enough before there's much progression. And so getting diagnosed early is extremely important. And one of the big issues is women are considered or have been considered just carriers, which is not true. I mean, women do have the disease, but more importantly, women do need to be diagnosed if they have Alport syndrome, because they can also pass the disease on to their children. And those kind of that kind of knowledge is so important to know, so that you can, if there are any issues, you can address them as soon as possible. So that's a big issue for Alport patients, is getting early diagnosis, because we have the use of ACE inhibitors to prolong kidney function for a decent amount of time. I mean, I'm hearing that it can prolong kidney function for a decade or more, for certain patients.
Interesting.
Yeah, I can definitely attest to that, since I got early diagnosed when I was around 10 years old, and I took ACE inhibitors, and I lasted until I was 25, 24, and yeah, if I didn't have it, who knows when I would have started dialysis earlier.
Right, and in Kevin's case too, right? Kevin, you were not even diagnosed until you were in
Right.
kidney failure.
Right. It's interesting for even non-Alport syndrome patients that are listening. I think the statistic is 1 in 9 people have kidney disease, which is a lot. People don't realize how many people are affected by renal diseases, and a lot more people are at risk because of high blood pressure, which is becoming ever more common nowadays. But I was not diagnosed until 2 years ago when my kidneys went into failure, and I think part of the reason that too was they kind of saw some of the symptoms of Alport syndrome that now looking back we can clearly say it's definitely Alport syndrome, but because again our disease is a rare disease, I guess it wasn't that apparent when the testing was going on. So again, it's important to get tested. A simple urine test can be the difference between healthy kidneys and being sick for a very long time. So we definitely encourage anybody listening, especially now for National Kidney Month, go out and get tested. Easy test, and you'll have peace of mind that knowing your kidneys are working well.
Absolutely, that's great. That's great advice. I mean, really, a little dipstick test in the
Right.
doctor's office and a pressure, measurement go a long way. And there, like there said, there is medication out there that can prolong kidney function. So it's not like there is nothing that can be done. There are things that can be done. And in my family, my brother lost his kidneys when he was 16 years old, and he didn't have the benefit of ACE inhibitors. And my boys are now 18 to 19, and they still have full kidney function, as well as I do. I've been on ACE inhibitors as well, and so I mean, every year that it buys you not having to be on dialysis or a transplant
Right.
is.
Mm.
That's important now too because the longer you can delay it, hopefully science will catch up with research for not only Alport syndrome but for prolonging grafted kidneys and things like that. So the longer you can delay the onset of disease, hopefully there'll be better treatments and ideally cures for us in the not so distant future.
You mentioned treatments. One of the exciting things that's happening right now is there is it's a clinical study, a natural history study for
Okay.
Alport. It's called the Athena Trial, and it's on our website, alportsyndrome.org. And I would encourage anybody that is 16 years or older and is not in kidney failure but has a diagnosis of Alport syndrome to go to our website or the Athena Alport study website and consider joining the natural history study. It's really just to take measurements and do tests to see how the disease progresses to design better clinical trials for potential therapies. So I would, as a call to action for Alport Awareness Month and National
Sure.
Kidney Month, ask people to check out the trial that's going on right now.
Sure.
And consider part of that, because that's how we as patients can further the research, is by participating in these studies and trials.
Okay, Chris, was there anything else you wanted to speak to Sharon to regarding the summit before we move into how people can actually help spread hope and awareness and support this month?
Yes. There's something in recent news about the Senate and the House introducing a bill that would help improve research and treatment of chronic kidney disease. Do you think that summit help bring about that bill at all?
I do. I mean, we were advocating to have chronic kidney disease and Medicare Advantage, added to that to the bill. There's a portion in that bill where Medicare Advantage was not available to patients who are already on dialysis, and we were advocating for that. So I think that there are a lot of people in the kidney community and the rare disease community who are advocating every day on these bills, and I think our job as an organization, as patients, is to support their efforts. So to email and to contact our local congressmen and women and our senators and support those initiatives, and we try and get that information out through the foundation, through our website, through emails, through Facebook. So I think it's all of our jobs to support the legislation that's really going to improve the outcomes for kidney patients in general, as well as Alport patients. So we like to think our efforts hold some weight and are actually, making some changes and some headway. One of the things that's come to light is the amount of money spent on kidney disease research at the NIH is very small in comparison to research on cancer and AIDS. When you look at the magnitude of the problem of kidney disease, Kevin said it's 1 in 9. Actually, the number is more like 1 in 3 have chronic kidney disease and don't even know it.
Wow.
So look at the amount of patients affected by chronic kidney disease and the amount of funding for research. There's a big disparity. So there's a email going around right now on advocating with your local senators, your state senators, on asking for more funding for the NIH, specifically for kidney disease.
Interesting. Chris, anything else regarding the summit?
No, I think we're good on that.
All right, then I guess to wrap up, Sharon, do you have anything else? Sorry, I don't want to cut you off.
Yeah.
I hope that we can get you young guys there, at some of these summits, because I think it's very powerful for your legislators to see young people affected by Alport syndrome. Stories are so, inspirational and important for them to hear. So we hopefully can help you guys get to, future summits so that you can participate too.
And just for people listening who want to know more about my particular story or Chris's story, our website, alportsyndrome.org, does have a family story section. So you can read up on us and hear our stories. And we're kind of doing a social media onslaught this month on our Instagram and on Twitter and on Facebook. We're going to link all those in the comments section of this video. And we encourage you to check those out and to please share them with anyone, not just renal patients, but with anyone this month, to educate everyone on diagnosis of kidney disease, diagnosis of Alport syndrome, what you can do in your community and in the Alport syndrome community to help out and spread awareness, take action, possibly do a fundraiser, so on and so forth. That's all going to be available on those social media sites. We'll link at the bottom. So I'm pretty sure that's all the stuff Chris and I have right now.
Yep, that's all.
So with that said, Sharon, thank you for joining us.
Thank you very much for having me and for arranging this. I appreciate it.
And we look forward to talking to you soon.
Okay, thank you.
Take care.
Thank you. Take care.